What if your body was giving you warning signs, but you didn't recognize them? What if the fatigue you feel, the constant thirst, the unexplained weight changes weren't random, but signals? Because that's how diabetes often begins, quietly. Not with pain, not with something dramatic, but with small changes that are easy to ignore. Diabetes is a condition where your body cannot properly control blood sugar. This happens when your body either doesn't produce enough insulin or cannot use it effectively. And over time, high blood sugar begins to damage your body, from your heart to your kidneys, your eyes, and even your nerves. But before it gets to that stage, your body speaks. You just have to listen. Some of the earliest warning signs include constant thirst, no matter how much water you drink, frequent urination, especially at night, feeling tired all the time even after rest, blurred vision, slow healing of cuts or wounds. You might also notice unexplained weight loss, or in some cases, weight gain, increased hunger, tingling or numbness in your hands and feet. These signs may seem small on their own, but together, they tell a story. A story that something inside your body is not working the way it should. So what causes this? Many people think it's just sugar, but it's more than that. It's a combination of lifestyle and internal factors. Poor diet, high in processed foods, sugar and unhealthy fats, lack of physical activity, sitting for long periods without movement, excess weight, especially around the abdomen, chronic stress and poor sleep, and sometimes genetics. These factors don't cause diabetes overnight. They build up over time, choice by choice, habit by habit, and that's why prevention is possible. Because the same way it develops slowly, it can also be controlled through small, consistent changes. Eating better, moving more, sleeping well, managing stress. These are not just healthy habits, they are protective actions. Now, if diabetes is diagnosed, treatment becomes essential. And the goal is simple: control blood sugar levels. This may include medication like metformin, or in some cases insulin to help the body regulate glucose. But medication alone is not enough. Lifestyle remains the foundation. A balanced diet, regular exercise, monitoring your blood sugar, staying consistent. Because diabetes is not just managed in hospitals, it's managed in your daily routine. Here's the most important truth. Diabetes doesn't have to control your life, but ignoring it can. The earlier you recognize the signs, the earlier you take action, the better your outcome. So don't ignore your body. Don't dismiss the small signals, because those small signals could be the difference between early control and long-term damage. And your health, it's always worth paying attention to. Thank you for listening.